I'm Dr. Venu. We are in the segment of Frequently Asked Questions with GLOJAS. Firstly, let me start with what is BOTOX actually? BOTOX is a cosmetic drug that is used to paralyze the muscle temporarily. It contains neurotoxin that acts to paralyze the muscle. Neurotoxin blocks the nerve signals where it prevents the muscle from contracting as well as reduces the appearance of wrinkles and the new ones to form. Many of my patients ask me, what is the aftercare after a BOTOX treatment? After a BOTOX treatment, one should avoid alcohol consumption because it increases the risk of bruising. Next, you should relax the rest of the day to maintain the normal heart rate and reduce the exposure of sunlight. Constant exposure to sunlight will increase the risk of flushing, increases your blood pressure as well, where it would lead to more bruising. One should also avoid a physical touch, a constant pressure or rubbing on the affected area. One should also avoid treatments like facial massage, exfoliating scrubs, dermal fillers at least for the next 2 weeks. You should not sleep on the affected area as it is going to increase the constant pressure over the affected area for at least 24 hours. If you have any further questions regarding BOTOX or any skin treatments, you can always leave a comment below. Don't forget to like, share and subscribe our video for further info. Bye!